Hello, everybody. Thank you so much for bearing with us. Just waiting for Dr. Venkat. She did appear as though she was online, so apologies. For some reason, she wasn't showing. Here we go. Right. Okay. Hopefully it will connect now. Let's see. Hello to everyone who's joining. Thank you for coming back. We're just waiting for the connection to work, and then we will be able to talk all about egg freezing and answer your questions. So hello, welcome back. Hi to those who are joining. Thank you. It just says that it's waiting for the connection, and there were a couple of questions before, so we'll make sure that we have those answered too. Good evening, Dr. Venkat.
Hello, good evening.
Apologies.
You can call me Geeta. It's fine.
I'm sorry, I don't know what happened before. I couldn't see you to add, but we're here now, so that's great.
Okay, can you hear me and see me clearly?
We can. Yes, we can. We're seeing you from upwards. That's better. That's a bit better. Great. Hello, everyone who's joining. We're going to be talking about egg freezing this evening. So I was just saying before that we'll be talking about when is the right time to pursue egg freezing, why people do it, what the options are, what's involved in terms of the checkup and also the process, the costs, and the potential success rates. So someone's just asked actually about costs. So would you mind just giving us an introduction about who you are? Tell us a bit about Harley Street Fertility Clinic, and then we'll start talking all about egg freezing.
Okay, thank you very much, you guys. I am Dr. Dr Venkat. I'm the director of Harley Street Fertility Clinic. This clinic has been in existence for the last 10 years. And prior to that, I have been working in all the prestigious clinics in Harley Street, IVF clinics in Harley Street for the last 25 years. Of course, that shows my age, which I don't want to say. And so this, the IVF has been changing since I've been practicing, as you know. There was no talk about egg freezing 10 years ago, but now everybody is talking about it. I think it's an important development in the IVF field, as well as it is in the women's history, because it gives an opportunity for the women to take control of their fertility, because life just goes in different directions for everybody and we can't plan the life. Therefore, if it is the situation, if you haven't met Mr. Right and you're busy doing exams, you want to come up in your life, then you have no time to have a baby and look after the baby, because you want the best of your life, in the sense you want to enjoy having the baby. Therefore, what you can do is freeze your eggs. So how did this change happen suddenly, you might be wondering? Because 10 years ago, the egg freezing technique was not very good. As the technology advanced, the technique has sort of improved a lot, and it has been perfected. That means it gives you a realistic chance of having a baby. That's what I mean. Say before, we were freezing by a technique called slow freezing, whereas now it's called rapid freezing or vitrification in technological terms. So we freeze the embryos and we freeze the eggs by this new method. That means we sort of take the eggs in a container, in straw, we call it, and dip them to suddenly minus 160 temperature. And that's called rapid freezing. What it does is, normally the contents of the egg form ice crystals during the freezing process. Whereas if we do this method, there is no time for ice crystals to form, and therefore the success rate with egg freezing is much better. Previously, we used to get something like 40% of the eggs surviving, whereas now we get 80 to 90% of the eggs surviving after freezing, which is a huge improvement. And also the success rate of having a baby with the frozen eggs is something like 40% to 45% now. 10 years ago, it was only 10%.
Gosh, that's a huge increase. Sorry, Dr. Venkat, please could I ask you to pull your camera down, just because we can only see half of your face at the moment. That's better.
Is it any better?
Yes, thank you. Great.
Sorry.
Okay.
I'm not used to this like you.
I'm sure everybody will forgive you. So let's start from the beginning. What are the reasons that people usually choose to pursue egg freezing?
Okay, one is because, like I said, it's the social circumstances and they are busy with their life and they haven't met Mr. Right. And also they want to settle down professionally.
Mm-hmm.
They want to buy a house and go move into a good area so that when the child is born, they are able to send the child to the good school and all this preparation for a good family. And that's why they are waiting for the right time in their life to have a baby. Whereas now, because the biological clock is running out soon, they may not have time. In which case, if somebody wants to have a baby with their own eggs, the genetic link is very important here, then it is important to freeze the eggs. That is why people in their 30s and 35, like they think that they are running out of time, they come and freeze. I want to make people aware, saying that think about it much earlier. Don't wait till you are 35. Because that becomes rather late. I think we should start thinking about it before 30 and start doing something about it, because the quality of the eggs go down as one gets older. Therefore, if you do it when you are young, it gives you a much better chance because the eggs have a better quality at younger age. And that is the reason we say. And in some families, women go through menopause early. I remember a patient where the mother went through menopause at the age of 28.
Wow, gosh, that's so young.
Yes, and she brought her own daughter because she went to the GP and said that, look, I went through menopause at 28. I had this little girl. She has got only one girl at the age of 25. I was lucky I had her. So I don't want her to suffer that. Please do something. And the NHS, of course, unfortunately, they didn't have the facilities at that time to investigate her. So she came to our unit and we checked her AMH. It was only 2, which is very low, between 1 and 2. And I arranged for her to have egg freezing straight away. So she came and froze the eggs, so which is an insurance policy for her. I think we like the way the women have cervical smears frequently. Every woman or young girl should have a fertility checkup.
Absolutely.
Or fertility MOT, we call it. And it's a simple blood test. And if they want, they can have a scan and do something about it before it's rather late.
Absolutely. And hello to everyone who's joining at the moment. I just want to say, watch until the end because we have a very exciting announcement to talk about. So let's park that for a second and go back to egg freezing. If people are interested and they're in their 20s or 30s, as you say, hopefully on the younger side of 30, what would be the process when they start to ask questions about egg freezing? If they come in to see you, what are the next steps?
Yes, normally they come to the clinic. I take a medical history and we do an ultrasound scan to check how many eggs are there in the ovaries. And at the same time, we arrange a blood test. It doesn't have to be any specific time in their menstrual cycle. It can be any time. It's not like day 21 on day 5 or anything. It can be any day in their cycle. We do a blood test that will tell us how many eggs are there. Now with the lockdown, we can do a virtual consultation from home. So I do a Zoom consultation with the patient, take the history, supposing there is any history of early menopause, all these things are very significant. And we send a home kit whereby the girls can do a finger prick test and send the sample to the lab. And the next day we get the result to the clinic and we arrange another consultation with them to give them the result and go through all the egg freezing process and arrange it once the clinic start. Now that we have heard that HFEA has announced that we can start the treatment soon, we will be able to arrange it without any delay.
That's great. Yeah. Okay. So once they've had that initial consultation and they've had the AMH checked with you, what would be the next steps?
Yeah, good. So next thing is we'll go through the process. That is, we arrange consultation with the nurses to go through all the screening tests, like viral screening test, which is a blood test, again, one blood test, and consultation with the nurses to complete the consent forms, because the people should understand what they are signing, because eggs are their properties. And therefore, there will be questions like how long they want to store the eggs. Okay. And if something happens to them, what should we do with the eggs? Because I can't make any decision. Mm-hmm. It is the property of the woman. Therefore, they have to make their mind up. And the nurses will guide them with this. Now we are doing it with, again, Zoom or Skype consultation to help the people to complete it. And then the process starts. Right. The treatment process involves hormone injections for something like 10 days. So every day, the woman has to do a single injection, which is, people are, I know, scared of needles. And it is not a big elephant needle. One need not be frightened of that. It is like a diabetic fine needle. Mm-hmm. Just goes under the skin on the tummy. Mm-hmm. And there are videos, we show them how to do it. It's very simple and it's not at all difficult. So they do it every day, and they come for something like 3 scans after starting the treatment, and scans and blood test on the same day when they come to the clinic. Mm-hmm. This will tell us how they are responding to the stimulation, that is the hormone injections.
Yes, so it's very similar to the IVF process in terms of stimulation, internal scans, and blood tests, as you said, to see how the hormone levels are.
Yes, correct. And so after 10 days of injection, usually most of the women are ready. That means all the follicles are large and mature. And we know that the eggs will be mature. And then we book them for what is called egg retrieval procedure. This is a very important procedure. People are really scared of it because they think it's going to be very painful. People need not be afraid of it because it's usually done under anesthesia. Anesthetist will be there. It will not be general anesthesia, so there are no risks of general anesthesia. It is called conscious sedation, so people will go to deep sleep. They won't feel any pain, and the procedure is a quick one, 15 to 20 minutes procedure, and they wake up at the end of the procedure. Mm-hmm. Usually, when I do the procedure, women usually wake up and say, "Oh, when are you going to start the procedure?"
Oh, really?
Yes, and we will usually say, "Oh, it's all finished." Oh, they don't even feel anything. I promise you, this is what happens. And it's very quick, and they recover. We sort of keep them for observation and monitoring for 1 hour after that. And then we'll give them a cup of tea and they will be able to go home. Only thing we say is, please bring somebody with you, because it's not safe for you to go home alone after the anesthetic procedure.
Mm-hmm. Absolutely.
So that's the important thing.
Okay, and how many eggs would you hope for a woman to get?
So usually 10 to 12 or 10 to 15, that will be average in younger age group. As one gets older, the number goes down, so it may be lower than that. And we think as professionals, it's better to have more eggs collected and stored, because everybody will say, "Oh, if I have 10 eggs, my God, I have 10 babies then." It's actually not true, because 10 eggs don't become 10 babies. Mm-hmm. The number will keep going down rapidly. That's because, Eloise, when we take out the eggs from the freezer, you lose some. Mm-hmm. And then when we fertilize with the sperm, we lose some more eggs. Then when the fertilized egg, that's called embryo, we let them grow and develop so that we can put them back into the womb. We lose some of them because some stop growing, every day. Therefore, 10 eggs will become 1 embryo in the end, or you may not even have it. Therefore, the realistic chance of having a baby will be given if you have something like 20 to 30 eggs.
Okay, and we've had a question. What would you say the best age is, or what's the age that women have kind of peaked in terms of the best potential for creating healthy eggs to have healthy embryos?
Yeah, that's a good question, because that's when you know when to freeze the eggs.
Exactly.
That is actually the fertility peaks in the late 20s. So women should consider freezing their eggs before 30, for a late 20, after 25, 27, and before around 30. But if you haven't done it before 30 and you have left it late, it's better late than never. So don't think that, okay, oh, it should be done before 30. I missed it. I won't do it. No, even if you do it at 35, it's not bad, but it's not ideal.
Okay. Okay. And actually, someone made a good point before. They said the problem is if you, for people in their 20s contemplating egg freezing, first of all, they may not be contemplating it because they still feel like there's a lot of time to meet someone. And second of all, as a 20-year-old, you're not as financially stable as you might be in your late 30s. So it's not necessarily a financial extra or burden that you'd particularly be able to take on at that point in your life. So that leads me on to the next question of cost.
Yes, that is true. You are absolutely right, because women are not in a position to pay so much money, because egg freezing is not cheap. I tell you it is, because it's very expensive. So the freezing procedure costs something between 3,000 to 5,000 pounds. 3,000 is freezing the eggs, and then you need these hormone injections, which will cost something like 1,500 to 2,000, depending on the dosage required for the individual patients.
Okay.
And then everybody has to pay storage fee for keeping the eggs in storage, which will be 25 pounds per month or 300 per year. And if women cannot sort of pay the whole amount, we have some finance plans in our clinic. People can pay some upfront, amount, and then follow it by paying in installments. This is to help the young girls. But some women I've seen that they come with their moms, and moms are very kind. They pay for the daughter's egg freezing. I've seen it in some families, but we are able to help them for this reason by the financial arrangement.
That's good. That's really good to know. So if you've got any more questions about the finances that Harley Street Fertility Clinic offer, then feel free to send them my way, and I can ask Dr. Venkat on your behalf, or pass on the information, or feel free to reach out and contact her directly.
Absolutely.
And I guess that is cheaper than a traditional IVF round, though, isn't it?
Absolutely. Yes, that is true, because they are not doing the full treatment here. So it is cheaper than the IVF. But remember, then later on when you come to use, you will have to pay. But hopefully by that time you would have settled in your profession, career, made some money to afford to pay for the treatment. But at this early stage, the clinic is happy to help you with the finance plan.
Okay. So one of someone who's watching tonight has said, due to low AMH, she can produce 4 to 6 eggs at each cycle. Unfortunately, not enough to freeze, but I always believe in quality over quantity. Yes. Would you agree with that?
Absolutely. That is why I insist on telling everybody, please freeze at younger age, because the quality will be better. So quality is equally important compared to the number. So at this, if someone is, say, 32 and her AMH is low, because of her younger age, her quality of eggs will be better than somebody who is 38 with low AMH.
Okay.
Therefore, her quality will be better. And even if she has lower number of eggs, because of the quality, she will benefit from freezing at that age.
Okay. And would you also say that for people who are starting out on this journey or thinking about this option, if you may not be able to produce enough eggs in the first cycle, so it might be a couple of cycles to get a sufficient amount?
Yeah, we say be prepared to do 3 cycles if someone has got low AMH, because they can produce something like 6 to 8 eggs. And I tell them, look, be prepared to do 3 rounds of this, so that you have sufficient number to give you a realistic chance of having a baby.
Okay, that's good to know. And that leads me on to the next question, which is, and if you're watching and have any other questions, please feel free to ask Dr. Venkat. She's more than happy to answer them, has a lot of knowledge and expertise, years of expertise. So for people who are considering it, in terms of numbers, what are realistic success rates?
Yes, okay. As I told you, when we take the eggs out, we lose some, but nowadays, with more experience with egg freezing, the chances of survival of the eggs is around 90%. Like I said, if there are some 100 eggs we take out, something like 90 to 92 will survive, 85 to 90 will survive easily. And also it depends on the quality at that stage. Somebody, supposing we freeze the eggs of someone who is 30, then they will have better survival than somebody who is 40. That is another important point. And this is the success rate of thawing the eggs, that is taking the eggs out. Then next question is, what is the success rate of having a baby? Mm-hmm. Like I said earlier, the chance of success is something like 40 to 45%, which is excellent in IVF terms or IVF world, because that is one of the highest success rate.
Okay. And in terms of freezing eggs rather than freezing embryos, does that decrease the success rate, or is there not really a concern with that anymore?
Yes, that is actually a very good question, because professionally we feel that freezing embryos are better, because embryos survive the freezing process better, whereas the eggs are more fragile and they don't survive the freezing as well as thawing process so well as the embryos. Having said that, there are other negative aspects with embryo freezing, like supposing you have a partner now, you have been in relationship only for a short time and you are not sure whether you want to have a baby with this partner, or things might change in future. In which case, if you freeze the eggs, it gives you the freedom.
Mm-hmm.
So sometimes what women do is they do one round of embryo freezing and one round of egg freezing as well, so that you also have that flexibility for future.
Okay. And how long would people tend to wait between cycles to retrieve another batch of eggs?
Oh, nowadays you don't need to wait at all. You can do consecutively 3 cycles. People have done research and they found that this does not reduce the number of eggs someone produces or reduce the success rate or any problem.
Okay, great. Someone's just asked, what day do you freeze the embryo? We're talking about actual eggs here before they've been fertilized. So for egg freezing, what would be the best day to freeze them at?
Oh, egg freezing is done on the same day as eggs are taken out. So we wait for 2 hours and then we check. One thing with the egg freezing, I must make people aware, we might get 10 eggs, but all 10 eggs may not be mature. Okay. We can only freeze mature eggs, because when you take them out, we cannot use immature eggs to fertilize, because immature eggs will not fertilize.
Okay. Sorry, Dr. Venkat, we've lost the top of your head. If you wouldn't mind just turning the cat. There we go. That's better. Thank you.
Yeah.
Sorry, please continue.
Sorry about that. So we freeze only mature eggs. So we wait for an hour or 2, and then we check how many eggs are totally mature, and then we freeze all those eggs. So egg freezing is done on the same day after a couple of hours of collecting the eggs. Whereas embryos, we allow them to grow to day 5. They become what are called blastocysts on that day, and then we freeze blastocysts, because the blastocysts survive very well with freezing and thawing process. And that is the idea. And the success rate of inserting the blastocysts into women also gives much better success rate than putting the earlier stage embryos.
I guess you know more about the you know more about how they're developing by that day, don't you?
Yes. We can see why we wait till day 5 is because it's the natural selection process. Only good embryos continue to grow, and then we freeze them. Whereas the earlier stages, most of the embryos will grow. Some of them will stop growing after that. So no point in freezing those embryos.
Absolutely.
And in addition, like you mentioned earlier in your announcement, if somebody wants to test the embryos, nowadays we are doing more and more of this pre-implantation genetic testing to choose the right embryo for transfer. Say if someone wants to get pregnant in the shortest time with IVF, then it is better to do embryo testing. So the testing is also done on day 5, that is blastocyst stage, and then we freeze the embryos after taking a cell out to send it to the genetic lab, because it takes 2 weeks to get the result. Once we have the result, we choose the right embryo, the embryo with all normal chromosomes. Then we put that embryo back. Then woman has a healthy baby instead of miscarrying or having an abnormal baby.
Okay, great, thank you. And we have a couple of questions, so could I just pause you there, please, and ask you, oh gosh, I'm not sure what's happening. If someone has a fertility test with you and think their reserves are low, do they have the same chance of getting pregnant naturally as they do by egg freezing and trying later?
Oh yes, natural trying does not reduced by a low number of AMH. With the natural trying, the woman releases one egg. So every cycle, as long as she's ovulating, as long as she tries before the number of eggs is very low.
Okay. Okay. And is it possible to improve a woman's egg quality? Sorry, I don't think the signal's very good, and also I seem to see a filter over you. I don't know if everyone else.
No, this is a controversial question.
So sorry, is it possible to improve egg quality?
Suddenly, is that any better? Oh, that is through my window.
I think there's some sort of background that's been added. I can't seem to see it, but anyway, we will continue. It's very nice, whatever it is. So the question was, what can be done to improve egg quality? Can you still hear me?
Okay, can you see now?
What I will do.
Yes, so there are DHE and CoQ. I can hear you. Can you hear me?
Yes, that's better. Thank you. Okay, sorry, what were you saying, Dr. Venkat?
Right. Can you hear me now, Alice? Can you hear me?
Yes, that's perfect. Is it impossible? Is it possible to improve egg quality?
Yes. Again, that's a controversial question. And we have supplements like DHEA and CoQ10 and melatonin, which improve the quality of the eggs. And DHEA is supposed to improve the number of eggs as well.
Okay.
But it doesn't work in every woman who takes it. Therefore, I tell them, look, there is no harm in taking these medications because there are no major side effects.
Mm-hmm.
And it takes at least 2 to 3 months for the medicines to have some effect. So what I tell them is start these medications, do the first round of egg freezing. And when you come to the second round, these medicines would have acted, because I don't want them to wait for 3 months. The egg number might go down in case the medicines don't work. Therefore, the best of both, it's better to start the medication and also start the egg freezing process at the same time.
Absolutely, absolutely. Thank you for that. And how long does it take for an egg or an embryo to be thawed?
Oh, that takes only half an hour. Within half an hour, you know if the egg or embryo, the thawing process, and it has survived. That means if embryo is going to die, the thawing process, taking it out, then within half an hour we will know. And in case we need to take another embryo out, we can do it straight away.
Okay. Okay. And what percentage would you say make it past the thaw?
In case of embryos, they're very good. It is between 95 to 98, which is.
Wow. That's very high.
If they're especially.
Oh, I'm sorry, we're losing the connection a little bit.
With blastocysts.
Dr. Venkat, we're losing the signal a little bit. What I'm going to do
Which is amazing.
And then log back on.
That's why everybody loves freezing embryos.
Okay, great. The signal isn't very good, Dr. Venkat. What I think I'll do is log off, and then if everyone could please join us back, we'll finish our conversation. We have a very exciting announcement. So bear with us and let's log back in now.